Granulation tissue is very common at the gastrostomy site, whether it is a button gastrostomy or PEG tube. It is part of the healing process, and it is what we expect to happen, especially in the first few weeks of after the operation. Usually it settles, but sometimes it can form a bumpy pinkish tissue which can bleed. There are various ways to deal with granulating tissue. Some of them can be easily done at home or by your community nurse or by a specialist nurse. It is not infection, it itself does not require antibiotics, and sometimes can be due to the button being too tight, and occasionally it is due to infection, underlying infection.
I'm just going to talk a little bit about granulation tissue around the stoma, gastrostomy stoma site. Granulation tissue is very common and it's a frustrating problem but not overly serious, but can be troublesome to get rid of. Our treatment alongside the community nurses consists of trying various different washes or creams. Our favourite and most used treatment at the moment is Prontosan wash and Prontosan gel, and that helps to reduce the bacterial load around the site. Going on from the washes and daily care, we use Maxitrol ointment, or you can use the hydrocortisone cream as well. It's probably worth using one for 2 weeks and then trying the other if the first doesn't work effectively. We also use salt therapy, where you can apply salt to the granulation tissue to help that settle down. You protect the skin around using Vaseline just to ensure that the salt doesn't go on the good skin. That can also be effective and can be used for ongoing care. Our last treatment would be to use silver nitrate sticks to cauterize the granulation tissue. This can be done in the hospital setting and can be repeated on a weekly basis just to help that granulation tissue settle. It might be that once it's been treated with silver nitrate, it then responds more effectively to a steroid cream. Very occasionally, if the granulation tissue doesn't respond to treatment and is considerably large, the surgeons will, if the child's having a separate operation, also cauterize and remove that granulation tissue in theatre at operation.